Our Ask. Act on the information that we already know. Spotlight on people's lived experience. Jason. A deaf person's experience.
My name's Jason Hickson. Usually when I'm trying to change an appointment, or if I want to even book an appointment, I have to rely on my wife. And I can't phone, I'm also at work. So it's obviously confidential information and I don't want to disclose that at work. So my wife has to go in and then has to text, okay, I'm here. And then she'll give me the date and time and check that that's okay. So we've had to do it that way in order to confirm that the appointment's suitable. The only problem is when I confirm an appointment on that day, they need to check with an interpreter. And it depends whether an interpreter is available. Sometimes you can be waiting between 1 and 3 weeks. I think it's important in terms of communicating with GPs or even hospitals, but when we receive a text message, sometimes I get a text to say that the appointment's cancelled with no explanation, but I'm not able to respond, so I can't respond and say, why is that cancelled, or whatever the case may be. There's no explanation. For most deaf people, it would be really beneficial if they were able to text back. I remember at Middleton, I fed back about the texting that, deaf people receive text messages but are incapable of texting back. And that was a while ago and nothing's been done about that. The deaf community, they're just tired of giving feedback when they see no changes.
Sean. The experience of a person with learning disabilities.
My name is Sean Webster, MBE. Because I got learning disabilities, I got dyslexia and short-term memory issues. And a lot of time when they gave me letters in white background, too much information. What they need to do is work with people with learning disability from day one, from hospitals and doctors. Ask them what worked for us. Don't guess, because a lot of time when we get letters, it's like reading a book, and it takes you independently. If I were doing it, I'll tell them I want my information on pale green background, 16 font size, 1.5 gap, bandana, and put your keywords in bold and do it step by step. If they were talking to me on my appointment, I want to explain to me step by step. It will make it easy for me to understand what is happening. If my support worker is with me, talk to me always. And I ask my patient if he needs to talk to my support worker. I'm the patient, he or she is not.
Yuping. The experience of a non-English speaker.
My name
is Mr. Lam. I live alone in a council house for older people. The biggest problem I face is the language barrier. I find it very difficult to communicate with doctors, hospitals, or deal with any repair issues with the council without someone to help me interpret. I once called into my doctors to make an appointment. I did not understand what the receptionist was telling me. Later my friend came and said the receptionist had asked me to book the appointment online. I have no computer and don't know English, so have to rely on my friend to help. When I receive letters in English from health or care services, I can't understand them, and my friends are not always available to interpret them for me. I feel so helpless a lot of the time. I wish there is a department that can help to solve all my language problems. It can arrange professional interpreters before service calling or seeing me, and high-quality Chinese-English translation for my letters. Carl. A blind person's experience.
My name is Carl Proud. I am totally blind, so I see nothing at all. My GP tends to make phone calls if they require anything from me, which is accessible for me because I'm visually impaired, so they don't send letters. They also send texts, and those texts are accessible for me because I use assistive technology on my mobile phone, which can read out the text. I still receive letters from hospitals making appointments. In an attempt to stop letters coming to me, the hospital decided to take out my address. And in the address field for their system, they wrote, please don't send letters, only contact by phone. And what then happened was that a letter was printed with my name on, it had a postcode on, and it had that block of text saying, so no address, but said please don't contact by letter. And that got sent out on a couple of occasions. And what happened then was that someone, the post office, delivered it to what seemed like a random address on the street. They then posted the letter on Facebook. Somebody then saw it who knew me and was able to say, and they came around and dropped the letter off. We have been asked for feedback, and we repeatedly have said. So really it's about a matter of simply follow the accessible information standard, follow the rules that are already laid down and follow them consistently.
Thank you to Jason, Sean, Yu Ping and Carl for sharing their experiences. Produced by Healthwatch Leeds in collaboration with Ro Lara.